So why should you as a professional care about the ecosystem view? Assalamu alaikum and hello everyone. I am sohaibzaib, and in this video, I'll break down the healthcare ecosystem for you in simple terms. Whether you're from pharma, IT, or management, this short video will give you the foundation that most people miss. It's the framework. It's the same framework I use when training corporate teams or healthcare startups. Before we begin, a quick introduction about myself so you know where this perspective comes from. I hold a Master's of Science in Health Informatics from George Mason University in the United States. And I began my career working there, and I was part of one of the first operational HIEs, the Health Information Exchanges, called Mass Highway in Massachusetts. That's where I gained hands-on experience with interoperability, clinical data standards, and hospital integrations across systems like Epic and Cerner. Later, when I moved to Saudi Arabia, I had the opportunity to work on a completely greenfield EHR initiative where I helped design and define workflows and requirements for a national implementation planned across more than 2,400 clinics. Over the years, my focus has been on optimizing clinical workflows, identifying gaps, and aligning health IT solutions with real-world clinical and administrative needs, from physiotherapy to chronic disease management and preventive care programs. So what I'm sharing with you today isn't just theory. It's an experience drawn from working across multiple healthcare ecosystems, from the US to the Middle East. Let's start with the 5 main players that make healthcare work, or sometimes don't work. So starting off are the providers, the face of healthcare. Providers are the hospitals, clinics, telehealth companies, and labs that directly deliver care. They depend on systems, whether manual or digital, to document, bill, and deliver treatments. But here is the key insight. Providers don't make decisions independently. They are influenced by payers and regulations. That's why understanding who funds healthcare is critical. On number 2 are the payers, the decision makers behind the scenes. Payers are insurance companies, government health programs, and sometimes NGOs. They control reimbursements, meaning they decide which treatments are covered and at what rate. So when you hear doctors complain about claim denials or patients about high out-of-pocket costs, it's the payers' policies at work. At number 3 are the regulators, the gatekeepers. Every healthcare system needs laws and ethics. Regulators like the FDA in the US or the NHS in the UK, or maybe the Ministry of Health in your country, ensure safety, quality, and compliance. They define what's allowed to reach the patient. Without regulation, innovation becomes dangerous. But with too much, innovation slows down. Finding that balance is what modern healthcare is struggling with. At number 4 are the technology vendors, the connectors. So now enter the technology side of things, the EHR providers, telemedicine platforms, and AI companies. They connect the ecosystem, turning paper into data and data into insight. But here's the problem. Most systems still don't talk to each other. That's why interoperability is one of the biggest challenges today. At number 5 is the patients and data, the center of it all. At the center sits the patient and their data. Every lab result, prescription, or variable reading tells a story. But the future belongs to those who can connect all this data responsibly without compromising privacy. Because the next generation of healthcare will be personalized, data-driven, and preventive. So why should you as a professional care about the ecosystem view? Because understanding it changes how you design, build, or market healthcare solutions. If you're in IT, you'll design systems that actually fit clinical workflows. If you're in management, you'll understand cost flows and reimbursements. And if you're in education, you'll teach healthcare with a real world context, not just theory. After working in healthcare tech for years, from EHRs to telemedicines to RPMs, I realized there is a massive gap in awareness. People join healthcare roles without truly knowing how the ecosystem operates. I've seen developers having absolutely no clue about it. Some of them even don't understand the simple terms like payers, providers, That's where I come in. Through my corporate sessions, I simplify the complexity so your teams can make smarter, faster, and compliant decisions, whether they are developers, analysts, or even executives. If you are a corporate team, an educational institution, or a startup working in healthcare, and you'd like to book a training session, a workshop, or even a lecture to help your people understand the healthcare ecosystem, I'd be happy to collaborate. You can reach me directly through the links below. Once again, I am sohaibzaib, and thank you for watching. May we all work towards a healthcare system that truly serves humanity.